Good evening, everyone. We are going to go ahead and get started here, I believe. We have some people still trickling in, but I want to welcome all of you to the Gettysburg Hospital Foundation's community chat event. For those of you who don't know me, I'm Kristen Vogt, the director of the Gettysburg Hospital Foundation. And I want to start with just a word of thanks and gratitude for your support of the Gettysburg Hospital Foundation and WellSpan Health in Adams County. This past year has been challenging on many fronts, and one of the challenging aspects for the foundation has just been the lack of just gathering in person to share updates with you. And in the past, many of you have attended our in-person events, and we really miss that opportunity. And so we are hopeful that this time will give you a little bit of an update on the work that we're doing here at the hospital, as well as our COVID response efforts and the vaccine rollout. Today, we have with us our new hospital president, Mike Cogliano. Mike started his term as president in October 2020, but has been with Gettysburg Hospital since 2001, I believe. And so many of you know and probably remember Jane Hyde, our former president, who took a new role within WellSpan to lead our patient experience efforts. So without further ado, I'm going to turn it over to Mike to start with an update on our COVID response, as well as information about the vaccine rollout. So Mike.
Thanks, Kristen. Good evening, everyone, and thanks for joining us. As Kristen said, my name is Mike Cogliano, and I'm the hospital president. As many of you know, I'm not new to Gettysburg Hospital. I'm not new to WellSpan. I've been with WellSpan for almost 23 years now, which is hard to believe. And I've been here at Gettysburg for 20 years. I've served numerous roles over the years. It's been a really exciting career. It's hard to believe that over a year ago, we were just in the early stages of our response efforts to COVID-19. Time goes really fast. Across WellSpan since then, over 6,000 COVID-19 patients have been hospitalized. And as of 4/23, April 23rd, 505 patients have been treated here at WellSpan Gettysburg Hospital. One of the benefits of being a part of a large healthcare system is that it allowed Gettysburg Hospital to have access to resources and support to help us weather this storm. For example, we were fortunate to have adequate sources of PPE supplies when a lot of hospitals didn't. You probably heard stories in the news, with some nightmare stories about nurses having to use the N95 masks for a week at a time, soiled, wearing out, and we didn't have that experience, fortunately. That came as a result of a lot of work from a large team, planning and working as part of a large supply chain to make sure that that didn't happen. We also had assistance with staffing from our system, and we were able to shift and redeploy staff between different entities and departments as needed. In addition, we were part of an organized response to coordinate everything from setting up the tent outside the ED to developing visitation restrictions. All this was coordinated across our healthcare system. Here in Gettysburg, we're fortunate to have some internal flexibility with beds, and that allows us to handle the surge volume that we've had through our surges. Now, what's interesting is prior to the pandemic, we were always very busy. We were busy consistently for a solid year or so, and we were busy with COVID patients and still full during the surges. And now we're getting back, fortunately, to being busy again. We were able to redeploy staff during this period of time, especially when our surgery was curtailed for a number of months in the very beginning of the pandemic back in May and June. We were able to redeploy those staff to help in other areas of the hospital, which was really helpful. The risk we have now with the rising numbers again in our area, as well as the new variants that you've heard of, is that we're actually in a third peak. Some may say a fourth peak. It depends on how you count. We had a smaller peak in between the first and the second. And our numbers right now of hospitalized patients are higher than the first peak back at the beginning of the pandemic. But fortunately, they're not as high as the winter peak that we had. And I'm crossing my fingers that it stays that way. We've got a manageable volume right now. It's about a dozen or so COVID-19 hospitalized patients a day here in Gettysburg. I'm going to spend a good bit of time today talking about vaccines because that's really a critical topic right now. as we are in the midst of this third surge. The patients that are being admitted to our hospitals right now are primarily unvaccinated. And that's why I really want to focus on vaccines at the start of my talk. My hope is that all of you are vaccinated, but if you're not, I hope to impress upon you the importance and alleviate any safety concerns you may have. The vaccine rollout is a key aspect of allowing us to get back to some semblance of normalcy. And it's also a reminder that we need to be patient so we don't take risks too early, which can further infection and continue this surge. We do continue with our visitation restrictions, as I'm sure you know, at both the hospital and our outpatient locations. We are in our yellow phase of visitation restrictions, in which we allow one visitor per patient, and there are a few exceptions that we're able to make. We have a stoplight approach that's red, yellow, there's a purple, I believe, and then green, and we're in the yellow phase right now. And that is all based on the county positivity rate overall. It's we're about 15%, or slightly over that at the moment. We do still require masks at all times throughout all of our facilities at WellSpan, and our teams are making use of the proper PPE as well as sanitation efforts to keep patients, visitors, and staff safe. We unfortunately encounter patients and visitors frequently at our entrances who don't agree with our mask policy, and they unfortunately confront our ambassadors in unfriendly ways. And I'm asking if you could help us as ambassadors of Gettysburg Hospital and our community to help to encourage kindness and safe practices. I want to speak a little bit about vaccine safety and efficacy. This truly is our shot of hope with the development of the COVID-19 vaccine. And WellSpan started to administer the vaccine back at the end of 2020. I believe it was in mid-December. In response to the pandemic, our country has focused all efforts on creating safe COVID-19 vaccines. This means fewer barriers, more hands on deck to get the job done, and increased funding to achieve our collective goal. The US government brought together both public and private sectors to coordinate those strategies and accelerated the development of the most promising vaccines. Most importantly, though, I believe, is that efforts to speed vaccine development have not sacrificed scientific standards. The science behind these vaccines is at least 15 years old, more likely 20 years old. So they sped up the process, but the science itself is not new. And sometimes the public misunderstands that. And I get questioned frequently about the safety of the vaccine, given how fast it rolled out compared to other vaccines like the flu vaccine and others that we've seen. But I trust this vaccine, honestly, and I wouldn't have allowed my family to get it if I had any concerns. Now, WellSpan continues to work closely with the PA Department of Health to obtain shipments of the vaccine, and I'm happy to say that we're finally in phase 2. I was really worried at the beginning of this journey that it was going to take us a lot longer to get here, where everybody would have access to the vaccine, anybody over 16 years old, that is. But thankfully, we've had enough vaccine given to us. We've been able to move forward quickly. WellSpan meets with the PA Department of Health every Tuesday, once a week, and we talk about all of the vaccines that we gave last week, what our potential is in the coming week, and then they give us an allotment for that coming 7 days. That's the short time period in which that decision is made. In fact, WellSpan was among the first 100 hospitals in the state to receive shipments of the COVID-19 vaccine. And at WellSpan, we've already provided more than 270,000 doses of the vaccine, and that was as of 4/20 when we looked at that data. Just a little bit about the 3 vaccines that are available right now. We have Pfizer, Moderna, and J&J. I know you've heard a lot about J&J. These 3 are the available vaccines we have at the moment. They've all been through rigorous processes before being authorized, and they still have emergency use authorization by the FDA. They don't yet have the full FDA approval, but I'm sure that that'll come in the near future. A couple of weeks ago, you heard that the CDC temporarily paused administration of the J&J vaccine, and that was due to a rare clotting disorder that occurred in a small number of known cases. On April 23rd, just recently, the CDC resumed administration of the J&J vaccine, which is good news. What's nice is J&J, as you know from the media, is that it's just one shot. You don't have to schedule that follow-up shot, which is really convenient, especially when we're going out to the community to nursing homes and so on, and giving that. It's really nice to be able to just give it one and done. WellSpan yet does not have the J&J vaccine. We've never had it. I don't know if we'll get it in the future. We certainly may, and that'll help in some of those distributions that I described. But right now, we are only using Pfizer and Moderna vaccine. What's interesting about the J&J story is that was out of, there were 6 women, I believe, that were affected with blood clots. And that was out of almost 7 million total vaccinations that were given with the J&J vaccine. So, if somebody asked me, would I buy a lottery ticket if I had a 1 in a million shot of winning? I probably wouldn't even bother, right? So those are the odds that you have of actually getting a blood clot as a result of getting that shot. So the benefits outweigh the risks. Now, there are, of course, as with any vaccine, some individuals who should not get the COVID-19 vaccine or should take additional precautions. What we recommend is that you speak with your private physician if you have any questions or concerns, because he or she can give you advice based on your particular health situation. The vaccine, of course, is not recommended if you've had previous allergic reactions to any of the components of the vaccine. And when you come into the clinic, hopefully you've all been here with us, they give you a list to read through and make sure you're not allergic to any of those. And then there's certain situations, like if you've been treated with the antibody treatment, you have to wait 90 days, so on and so forth. Also important to note is we've had a lot of questions about the safety in pregnant, breastfeeding, and immunocompromised individuals. The FDA is now recommending that those individuals are likely to be able to safely have that vaccine, very low risk, and that, again, they should have a conversation with their providers to make an informed decision. But the overall guidance is it is safe to get the vaccine, which is really good news. Now, this is a really interesting slide. Let's consider the efficacy of the vaccine. So it's important to keep in mind that no vaccine is 100% effective. Studies have shown that both the Pfizer and Moderna vaccines are over 90% effective, which is really promising. And again, these are the 2 vaccines that WellSpan is using right now. Both of these vaccines require 2 doses, each of them after 1 week, which is really interesting, and I was not aware. After the first dose, you're about 52% protected, and around 2 weeks after receiving your second dose, you'll be up to 95% protected. Both of these vaccines work by the same biological mechanism, and it's important to complete your vaccine series with that same product. So you can't mix and match Pfizer and Moderna. They're not interchangeable because the safety and effectiveness of the mixed vaccine series has not been tested, so it's not worth the risk. You may have seen in the news recently that there are new strains of the COVID, the mutants that they have said that have been identified. This isn't surprising. All viruses mutate. We're not surprised at all by that. And the COVID virus has been mutating, in fact, since it was first discovered. It is believed that the new strain's mutation makes it more contagious, but the structure of the virus itself is not significantly different. What this means is that the antibodies produced as a result of the vaccinations we're giving will still protect you from the new strain of COVID. Most people, after they have our vaccines, do not have serious problems. Your arm may be sore. That was the case in both of my vaccinations. I just had a sore arm. Could be a little red, could be warm to the touch. The FDA says that these symptoms usually go away on their own within a week. You don't need to get excited. You don't need to go to the emergency department. Most people that I've spoken to, it doesn't take a week. It comes on pretty fast. The symptoms come on fairly quickly, and then they resolve within 12 or so hours, fortunately. So what's nice is that the side effects are a sign that your immune system is doing what it's supposed to do, right? I kind of felt guilty when I didn't have any symptoms except for sore arms, thinking that, is it working? Did I get the wrong vaccine? But when you're in the clinic, we'll observe you for 15 or 30 minutes just to make sure you're not having any immediate allergic reactions while you're with us. Now, we know there's been a lot of misinformation, especially shared out on social media about the vaccines. And we really want to try and correct some of that information for you. First of all, the vaccine does not contain a live virus, Both the Moderna and the Pfizer vaccines use what's called mRNA technology to give your immune system a set of instructions to help fight the virus. And since there's no live virus in the vaccine can't give you COVID-19. You need to receive both doses of the vaccine. So it is possible, if exposed before fully vaccinated, you could develop COVID-19, but you can't actually get COVID-19 from receiving the vaccine itself. You could get it, it's called breakthrough infection, and there isn't a high rate of that in between shots. The COVID-19 also does not cause infertility. We've been hearing this a lot, and it's pure misinformation. In fact, the American College of Obstetricians and Gynecologists endorses the vaccine for pregnant women. And then last, the COVID-19 vaccine does not enter your DNA. The vaccine uses mRNA technology. I keep messing that up. And this technology does not penetrate the nucleus of your cells where your DNA is stored. In other words, it doesn't go near your DNA. Now, almost done with vaccines, I promise. Appointments, if you don't already know this, they're available on a rolling basis, and we have a large amount of availability in a very short period of time if you want to get the vaccine now. And you can either use our phone number that's on your screen or log into my WellSpan if you have my WellSpan, and you can just create an account. You don't have to be one of our patients to create an account. That's the easiest way to get on there. And we do have 2 sites. Now, we've got the site both at the hospital in our community rooms and out at the 911 center on Greenmeyer Lane. Breaking news today, literally just came out today, is that WellSpan has identified a number of locations, and Gettysburg Hospital is one of them. The 911 center is not yet one of these locations. I just want to be clear on that. But Gettysburg Hospital, starting on Friday, the 30th, will take walk-in visits. And it's between noon and 3 p.m. You can share that with your friends. You don't have to go online, you don't have to make a phone call. They will actually register you during that time period from noon to 3 p.m. And so we're really opening it up, trying to make it as convenient as possible, especially our more mature patients who don't have easy access to the internet, and it's really struggling. You know, it's a struggle to make an appointment. Now you can just walk in and we'll take care of you. So that's really exciting. All right, I'm going to move away from the topic of vaccines now and give you some hospital updates. In the midst of the pandemic, in the midst of all this craziness, Gettysburg Hospital has remained the same high quality, trusted community hospital you've come to know and love. And in many ways, business continued as usual, and I'm very proud of our team. You will recall that we expanded our cardiology program a couple of years ago with a renovation of our cath lab, and we started to do interventional cardiology, AKA stenting. That program continues to grow, and it has in fact outpaced the original volume expectations. This prevents our patients from having to travel or be transferred to WellSpan York Hospital or elsewhere when they can be cared for here at home in Gettysburg. We're really happy about that. This is good evidence of this is the fact that I hear very much less helicopter traffic over the hospital these days. I used to hear helicopter every day, easily every day. I very rarely hear helicopter now. What's great now is we have a full cardiology staff. We have 2 interventional cardiologists, an electrophysiologist, and 3 non-invasive cardiologists. And this practice has expanded to have office hours in Hanover as well, 5 days a week at our WellSpan Health and Surgery Center in South Hanover. We have had a part-time electrophysiologist doctor that was doing pacemakers primarily. He has since retired, Dr. Zernosa, some of you may know him. He recently retired. We have an interim EP doc or a locums EP doc temporarily, and we have a new full-time electrophysiologist starting, I believe, the end of June, beginning of July. So we're really excited about that. To support the level of care that our cardiology program is providing, we have also advanced the capabilities of our critical care unit, again, so that we can keep patients here at home and not have to transfer them out. We have a highly skilled CCU nursing team, which is supported by intensivists and our hospitalist team. To supplement the providers in the unit, we're excited that in the coming months, we will initiate a virtual ICU service that will provide 24/7 eyes and ears. This is using video monitoring on each of our CCU patients, and that adds an extra level of support for the clinical team, boots on the ground. WellSpan Chambersburg and WellSpan Waynesboro Hospital have been using this exact same service for a number of years, been very happy with it. Now that WellSpan has grown to our current size, 8, 9 hospitals, multiple regions, we've divided the system into 3 regions. We have the East, we have the Central, and we're part of the Western region. And that has really been beneficial because we've been able to collaborate between Gettysburg, Hanover, WellSpan Summit with Chambersburg and Waynesboro hospitals on many of the aspects of care that we provide. And a great example of this is the sharing of urology providers that is currently happening between Chambersburg Hospital and Gettysburg Hospital. There are, I believe, 3 urologists now that rotate between Chambersburg Hospital and Gettysburg every day to help us provide an adequate supply of urology coverage and good access for our patients, because we don't want gaps in important areas of care. And in fact, on any given day, we can have up to 4 of those urologists in our Gettysburg office, which is interesting. I want to let you know that after many years of serving our community and hospital as an independent specialty practice, Gettysburg Diagnostic Imaging recently agreed to join the medical group effective at the end of March on the 28th. We've begun the process to make this a smooth transition, and we will be hiring additional radiologists to support the team. We recently welcomed Dr. Garazzo, Dr. Spagnoli, and Dr. Tan officially to the WellSpan family, even though they felt like family for 30 some years, I guess it's been. I'm sure you all know Dr. Jones, who started that group many, many years ago and has since retired. Also during the pandemic, we were granted or maintained several awards and recognitions. First of all, we received Nursing Pathway to Excellence recertification. Some of you may have heard when we originally got Pathway to Excellence original certification. It's very exciting. We also maintain our CMS 4-star rating. There are a number of metrics that make up the CMS rating, but one of them in particular that may resonate with you is readmission. So we don't want people to come back to the hospital within 30 days of being discharged, right? That's an indication that potentially we may have missed something, or we could have done a better job caring for those patients. Our goal is to be a 5-star hospital. We're steadily making progress in that direction. We maintain an A grade, a Leapfrog A grade. This is a massive improvement. In 2019, early on in 2019, we were actually a C grade hospital for Leapfrog. We are now an A grade hospital. I'm very proud of that. This is another publicly reported safety grade, and it's given to 2,600 hospitals across the country. And that A grade is a testament to the work we do to keep our patients safe from things like medication errors, falls, and infections. WellSpan Gettysburg was recently named one of HealthGrade's top hospitals for critical care. Our hospital was one of only 15 in Pennsylvania of all of the hospitals in PA to be recognized, and 3 of those hospitals were WellSpan hospitals. This is a testament to our outstanding CCU staff because it's critical care recognition, and it's also a testament to the support from our hospitalists and our intensivists. And then lastly, the Blue Cross and Blue Shield Association recognized us as a Blue Distinction Center for Maternity Care. Kudos to our entire maternity team, including the providers, the midwives, and the nurse practitioners for their hard work. Kristen, that's all for me. Thanks again for your time, and I will turn it back over to you, Kristen.
Great, thanks so much, Mike. We really appreciate those updates. And if any of you have questions, I wanted to mention this at the beginning of the call here, but feel free to type your questions in the Q&A box that you should see at the bottom of your screen. And we will have some time for some Q&A at the end here. I want to share a little bit about our centennial celebration. 2021 marks Gettysburg Hospital's 100th anniversary. Pictured here are John and Annie Warner, who broke ground in 1919 to build a hospital. John was inspired to build a hospital after the Spanish flu killed more than 150 soldiers from Camp Colt, as well as 100 local citizens. In fact, Annie herself contracted the Spanish flu, and John vowed that if his wife survived, he would build a hospital and name it for her. And thankfully, Annie did survive, and they were able to break ground for the hospital on March 5th, 1919. Through generous donations from several individuals and families in Adams County, the hospital opened on March 15th, 1921, and admitted its first patient on March 17th. And the hospital really did come into being through community donations, and it's generous donations from you and many others before you that have continued to give toward vital services, equipment, programs, and needs to help Gettysburg Hospital provide excellent care and support for our patients and neighbors in the community. And what's amazing to me, I think, about the history of Gettysburg Hospital is that it was a pandemic that inspired the Warners to build the hospital. And here we are 100 years later in another pandemic. Yet the generosity of individuals, businesses, churches, and more have continued, and people have continued to reach out and show their support during the COVID-19 pandemic through in-kind donations and monetary donations that have just really helped our team members in so many ways, not only put a smile on their face, but it's allowed us to leverage staff resources like Mike talked about. It allowed us to increase our bed capacity, and funds help support community health and wellness initiatives too, to help us respond to COVID. And so the Warners saw a need to respond, and the tradition of responding and giving back continues and is carried on by you and so many others. To learn more about our hospital's history, I encourage you to check out a commemorative 100th anniversary book with reflections from several current and former staff members. This book was developed by Dr. Ron Crablin, a retired physician, as well as a retired employee, Roseanne McGlade. Some of you may already have this book, but if you don't, feel free to reach out to me and we'll find a way to get it to you. And while the COVID-19 pandemic has delayed or postponed some of our plans to mark our centennial celebration, we are hopeful that sometime in the near future, we can mark this occasion in several ways throughout the 2021 year and 2022 too. Turning to the Hospital Foundation now, there are 3 brief updates I want to share with you all today related to our work before we send you on your way. The first relates to 3 new funds that have been established. The first 2 support community benefit initiatives for patients. Our Adams County Patient Support Fund has been established to help patients with needs that affect their treatment and/or their health outcomes. What's surprising is that as much as 50% of a patient's health can be attributed to non-clinical factors. Do they have access to food when they're discharged from the hospital? Can they afford their medication that's vital to their continuum of care? Do they have transportation to help them get home from the hospital or to their follow-up appointments? Or do they even have a home or bed to return to once they're discharged? We see many patients that struggle with these needs as it relates to their care journey, and we've established this fund to help at-risk patients. Linda's Fund was established in memory of Linda Cranius, who passed away from breast cancer. This endowed fund provides in-home private duty care for oncology patients who need assistance with activities of daily living while undergoing their treatment. And so this fund supports patients while they recover at their home, and we're excited to be able to provide this care in memory of Linda. And finally, the third fund supports our educational efforts for team members. This new fund was established in memory of a former employee, Jennifer Russell, who worked in the WellSpan Rehabilitation Department in Adams County and passed away this past fall from cancer. The Russell Bobco Rehab Lectureship Series was created by gifts from Dr. Philip and Barbara C. Bobco in honor of Jennifer Russell. Jennifer was a true healthcare provider in all senses of the words, and she was admired by employees and patients alike. Income from this endowed fund supports lectureships that provide a forum for clinical education, personal motivation, and the discussion and training of topics relevant for today's rehabilitation professionals. My second update relates to our annual golf tournament. For 34 years, we've held a tournament to benefit a variety of funds and initiatives at WellSpan Gettysburg Hospital. In fact, over the last 34 years, we've raised a total of $1.5 million through the tournament to support children's health needs, mammography needs, as well as medication assistance for patients. Due to the COVID-19 pandemic, we had to cancel last year's tournament, but we are extremely grateful for the many corporate partners who generously exchanged their tea time for full charitable contributions to support the hospital. I especially want to recognize our two lead sponsors from last year, AC&B Bank, as well as the law firm of Barley Snyder for their continued support. And we do plan to have our tournament this year at the Links on August 20th. And so for more information on how to participate, please feel free to contact the foundation office. And finally, I'll end with information about a new online resource for donors to learn more about legacy giving. Many grateful patients and supporters of the hospital have included Gettysburg Hospital in their estate plans. In fact, you might notice a few faces on this slide that you may know. This new website at gettysburg1919legacy.org has information on popular planned gifts, as well as smart giving options that you can potentially do today. So if you dream about what the future of healthcare looks like in Adams County and want to ensure a legacy of superior healthcare for generations to come, I'd be more than happy to connect with you about those dreams and how we can make that possible. So that kind of wraps up our information that we wanted to share with you this evening. We now have a few minutes for a brief Q&A session. We're going to take questions for the next 5 to 10 minutes or so. And if we don't have time to get to your question, we'll certainly follow up with you individually. Like I said, to ask a question, you'll see at the bottom of your screen, there's a Q&A button. And if you press that, a window will pop up for you to type a question. So let's see here, do we have any questions? Here we go, Mike. So I think I have one. Can you say a little bit more about the virtual ICU service and how they will work with doctors at the hospital?
Sure, no problem. We're using a service called Mercy Virtual. This is their sole business. They're based in Missouri. This is all virtual, it's all remote. And they provide this service for for many health systems, many hospitals across the entire United States. So it's not just here. And they employ critical care nurse practitioners as well as critical care physicians to provide this service. And what they do is they install both video and audio monitors in each of the critical care unit rooms. And they also link in with the vital signs monitors that are attached to every critical care patient. So now this isn't a replacement for the boots on the ground physicians and nurses. It's a supplement, really. It's a safety factor. It's a comfort level for the nurses that while they're taking care of another patient, somebody is watching their other patient. It's usually a 2-to-1 ratio of patients to nurse in the critical care unit. So it really is an extra safety factor for us. And so those remote nurses and physicians will actually monitor vital signs. They'll watch the patients physically. They can, if necessary, talk to the patient. There's also a sitter service. So if we have a patient that we're afraid may try to climb out of the bed, for example, we will no longer have to, and there's rare exceptions to this, but we will no longer have to physically position a sitter, a human person, just to watch that patient in that room. The virtual service will actually watch. They will notify the nurse and the physician right away if they see that the patient is trying to get out of bed, and then they will actually call in and talk to the patient in the room to encourage them to stay in bed until somebody comes in. So really a great service. And this is all that company does. And again, Chambersburg and Waynesboro has been using them for many years and really likes the service. So good safety factor for us. Really exciting.
That's really exciting. That's great. Another question we have here, I've heard that we're seeing a decrease in the demand for vaccine appointments in other parts of the country. Are we seeing that in Pennsylvania too?
We are, as a matter of fact. Yeah, good question. So we at the beginning of the distribution of the vaccine, we were full months out, as you well know. If you tried to get in right after the announcements were made of the original tiers, you couldn't get in, 2-3 months out. Now you have access a couple of days out. And I think that a couple of factors are at play there. Number one, the people who initially really were committed to getting the vaccine, and that appears to be the 65 and over population, they have gotten the vaccine, right? They were right on it. They got in early or mid-cycle and they got the vaccine. And so the younger population is still very hesitant, or for whatever reason doesn't think that they need the vaccine. And so we are definitely seeing less of an interest now. And thus we have easier access to get on the schedule. And we're opening up doing a couple of things. We're opening up the schedule to walk-ins to help encourage people to get in. We're also getting a lot of information out and participating in a new multi-hospital ad campaign to answer questions, to deal with the hesitancy that we're seeing in the younger population in particular, and to encourage people to come in and get the vaccine. Because just a reminder that the folks who are hospitalized right now are predominantly unvaccinated. We know that the vaccine is working. It's really important that you get it. It's better for everyone that way.
Great, yeah. And then Mike, do you or the hospital have any suggestions on how to talk to friends or family who are perhaps hesitant to get the vaccine?
Yeah, I think that helping them understand the facts, get the facts from reliable sources, CDC, Pennsylvania Department of Health, from WellSpan's COVID-19 site, from our public page. You just click on the red COVID-19 section. A lot of information in there. There's some videos. We're doing public relations videos on TV and so on all the time to help answer questions, to help alleviate concerns and hesitancy. It's really a safe vaccine, and we just need to help our friends and neighbors get factual information rather than the misinformation that's frequently out there in social media.
Awesome. Well, I think those are all of the questions that we have, but I just want to end with just thanking you all for joining us this evening. We're really grateful for your support. There are many initiatives that help our patients and the hospital that really wouldn't be possible without contributions from donors in this community. So if you have any other questions or thoughts following the webinar, please feel free to reach out to Mike or myself. But thank you so much for joining us, and we'll send you on your way, and have a great evening. Thanks, everyone.